Hello, my name is Melanie Jensen, and I'm currently an academic clinical fellow at Imperial. Thank you for the invitation to present this case report worked on with Dr. Kieran Allinson and Dr. Mayan Briggs. Heroin-associated leukoencephalopathy is a rare complication of heroin abuse. It is typically characterized by an encephalopathy developing over months, but cases of abrupt onset are rarely described. We present a fatal case of heroin-associated leukoencephalopathy and describe the associated neuropathology. A 32-year-old male presented to A&E in status epilepticus. His friends confirmed a recent heroin use. As shown in Figure 1, CT head shows symmetrical basal ganglia hypodensity with diffuse white matter abnormalities in keeping with leukoencephalopathy. He was treated with naloxone, antiepileptics, and antibiotics, but failed to improve and died 9 days after admission. Coronial autopsy was performed. As shown in Figure 2, the brain was congested and showed generalized cortical swelling. There was bilateral red necrosis in the globus pallidi and focal pallor in the corpus callosum. Luxor fast blue confirmed myelin loss in keeping with the demyelinating process. As shown in Figure 3, there was pallor and vacuolation of subcortical white matter with infiltration by sheets of macrophages. Myelin loss was seen on Luxor fast blue, again in support of a demyelinating process. Hair toxicology was consistent with heavy heroin and cocaine use in the 2 months preceding his death. The cause of death was deemed to be toxic leukoencephalopathy, secondary to inhalation of heroin and cocaine. In conclusion, we present an unusual case of acute heroin-induced leukoencephalopathy. Acute presentations of this are rare, but should be considered in the context of illicit substance abuse, particularly in view of potential reversibility. We show that a demyelinating process is central to the pathogenesis of acute heroin-induced leukoencephalopathy. Thank you very much for listening.